pulsed electromagnetic field therapy. To ensure that you get the best benefit from it, what we're going to do is do it in concert with a little technique that helps correct body balance. To that end, what we're going to ask you to do, if you'd come over, and for those of you who are watching on here, I want you to imagine that this is occurring in your office. You've got a client who's just presented, and we're going to get them set up in such a way as to facilitate, the use of this particular technique. So, Mark, if you'd come over, please. So what we're going to get you to do is, this is the standard massage therapy table. If you happen to have a chiropractic table with the little hole where the face is, a little bit shorter than this, that's ideal. In this particular example, we're going to assume that you're doing this on a massage therapy table, which is going to be a little bit longer than what would be ideal. So to kind of create the situation with that smaller table, what we've set up is a pillow and kind of a rolled towel, and we're going to get Mark to lie on the table in such a way that his feet are hanging free over the end, his chest is lying flat in the little pillow, and his head is straight, or his forehead is resting on the towel. Because in that situation, his neck will be straight, his feet will be hanging freely off the end of the table, because the moment that you twist a foot or twist the head, you're already reestablishing the imbalance pattern that we're trying to correct. Okay. Okay, so the first thing we're going to look for is, and it's very simple, is Mark's leg balance. The way that we do that, and it's again very simple, we're simply going to take his two shoes, line them up very square at the end of the table, and just have a look at whether one hangs a little bit longer off the edge than the other. As you can see by observation, in Mark's particular case, he's about roughly, call it half an inch to 3/4 of an inch short on his right side. What I'm now going to do is ask Mark to just relax his feet into my hands, and I'm going to very slowly bring his feet up, and I'm going to ask him to tell me if he feels any tightness, restriction, or pain anywhere in his legs or his upper torso. Anything?
A little bit right here.
Okay. One of the interesting things about this little leg raise technique is you get some feedback from the person as to, what's actually happening as part of the imbalance pattern. The other thing you notice is when you actually bring the feet back down, the functional short leg actually goes a little shorter. What we then look for is just overall symmetry of the person's body. Mark is actually not too bad when you kind of look in terms of overall symmetry. He's a little bit elevated on the left side, right here, and we're going to be looking for basically the comfort or kind of what I would call the suppleness of his neck on either side. What you're looking for when you do this is the origin of a reflex that we'll talk about in just a moment. But as I feel into Mark's neck, on one side or the other, what I'm actually noticing is he's a little bit tighter on the right side than on the left. If we go on from there, basically, again, the whole idea behind this is teaching people things that they can do to take better care of themselves as a result of using the pulse and being in contact with the services you're providing. And this is something, again, that they can do at home at very, very little cost. And in fact, one of the reasons that we set it up, the demonstration of this using the massage therapy table, is that most people attempting to do this at home will similarly not likely have a chiropractic table. So what an individual can do is actually lie across their bed and set it up exactly like this. The feet hanging free or freely, the chest popped up on a pillow, and the head down and positioned on a towel or something. It's key that the neck is straight, and it's also key that the feet are hanging freely in this position, because the moment that you start doing a twist of any kind, you're obviously recreating some form of imbalance. One of the key things and one of the reasons that we talked about or looked for that imbalance pattern in the neck or that reflex is there's a very simple way that an individual can work to repattern that as well. What we actually use for that, if you imagine that the roll towel that Mark currently has his forehead on looks something like this neck roll that that kind of is exactly what you're looking for in this situation. What we would do is create a situation in which we would have the individual lying on their back, obviously, rest with that roll towel under their neck, and what that actually helps to do is to restore the contour of the cervical spine. When we're kids or children, as we learn to crawl, we learn to position our necks in a certain posture, and that's actually the intended posture, of our neck, if you will. And unfortunately, throughout life, we tend to lose that. You'll see many people walking around with their heads a little bit too forward. And the downside of that is, if you imagine there's a garden hose coming out of your brain that's kind of carrying all the energy from your brain to your body, the moment that your head starts to go forward, you crimp it just as if you were crimping a hose in your back in your garden. So again, by positioning an individual on their back, lying with a neck, a roll towel or something that's about the same size as this neck roll approximately, they'll actually start to reposition the correct contour of the cervical spine. And we have a methodology for helping people to actually target that reflex, because the great thing is while the individual is lying on their back, they're not only maintaining the contour of the cervical spine or reestablishing it by figuring out a way to trigger that reflex, you're actually effectively simulating what wedges are doing. So it's kind of a twofold benefit to doing that. One of the common things that people will also come into your office complaining about or making comment about is problems with sciatica. One of the best ways of dealing with that, again, with the wedges in place, is to position, what we call the butterfly coil around kind of the sort of the mid-lumbar area, and allow the energy to actually pulse into that area. There's also a technique that we would use if, for example, it was on the right leg, the sciatica was being reported. You can actually use the long coil, what we call the rope, and use a wrapping technique on that particular leg as well. But do that in concert with the use of the butterfly in the kind of central lumbar position. The nice thing about this particular protocol with the wedges as well is it's very easy for somebody to learn how to do this, and it's the kind of thing that an individual can take home with them. Tends to make their family pretty happy when they can go back and kind of demonstrate how to do this and teach people how to do this. And the analogy between the wedges is really kind of like brushing your teeth between dental appointments. If there's anybody watching this who's a healthcare professional, we're not recommending people do this in lieu of coming to the chiropractor, etc. The idea behind this is to do something that will augment the benefits of your care in much the same way that brushing or flossing would augment a dentist's care. So that's one of the key points on that. The nice thing about it is, the technique is very easy to follow if you do that step by step, looking at the leg balance, and you really want to kind of work on identifying what the reflex is in the neck, because there's a very helpful thing you can do. We're not trying to turn people into chiropractors or massage therapists or physical therapists. What we're trying to do in this particular technique or with this technique is give you some very practical things that you can do to make your use of the pulse machine most effective. So when we talk about what we're looking for with the person lying prone in this way, is just whether there's anything obvious to the eye in terms of asymmetry. And as you look at Mark, what you can actually see is a little bit of kind of a raised shoulder on this side. Do you have any sort of overall, what I would call pain or discomfort in any place? Sorry.
Right
Okay, so kind of down in that area, nothing up through the shoulders.
Not really.
Okay.
Yeah.
Okay. The next thing that we're looking for is the suppleness of the neck. And the neck is intended to be fairly soft to the touch on either side. And this part of the protocol is a little bit subtle in terms of finding it, but when you actually find what you're looking for, you'll see it has a fairly dramatic effect. In Mark's particular case, he's short on the right side. In 80% of the cases when somebody is short on the leg side, you're expecting what will be the compensation pattern in the neck to be on the same side. So that's 80% of the cases. Similarly, if he was short on the left, in 80% of the cases, you'd expect it to be on the left side. So what I'm going to do in this particular case is I'm going to apply a pressure kind of in the general, call it the kind of the center to the back of the neck on his left side. I'm going to ask him if he feels any pain or discomfort.
Yeah.
So you do it when I do that?
Mm-hmm.
Okay. And then we'll, out of a 10, what would you describe it as?
2.
A 2? Okay, if you come back now and look at the leg balance, what we've actually discovered in terms of that with Mark is that he's actually the crossover pattern. Before he was pretty close to 3/4 of an inch short on the right side. When I actually pushed on that side of his neck, it triggered a reflex that actually corrects the leg balance, and you can see he's now even on both sides, or yeah, even on both feet. So basically, what's happening with Mark is, as a result of the things he does throughout the day, whether it's lifting or chasing his kids or whatever the case may be, he's created a muscle imbalance in his upper body, and that actually works in kind of a domino effect. So what's actually happening is, a result of the imbalance pattern up here, it's actually causing the hip on the right side. And this is a very simple description of what the hip looks like if you've ever seen a spinal model. But in any case, we're going to call the hip on this side and the other side a wheel. And what's happening is the wheel on this side, because of this upper body imbalance pattern, is actually rotating too far back, and it's pulling the leg on the right side upward or short. And what happens in this kind of a gait motion with the hips is, when the hip on this side comes too far back, the one on the opposite side compensates by going too far forward, and you get what's referred to as a functional short leg. So it's not that they're anatomically shorter, it's just that they're functionally shorter. If you think of how all of this interrelates, the pelvis is basically the foundation of the upper body, and the pelvis is of course supported by the legs or the hips. So if you end up in a situation where the support on one side is shorter than the support on the opposite side, that support or the foundation has no choice but to actually drop to the short side. So if you want to imagine Mark's pelvis in this kind of a way, instead of being straight across, it's actually going to drop slightly, not as dramatically as my hand, but it's going to start to shift or drop a little bit to the right. Then as you imagine the vertebra sitting on top of the pelvis, as you start to stack them, if they were bricks, you'd want them to be straight. Instead of that being the case, the vertebrae actually start off on the pelvis, but because the pelvis is tipped, it has no choice but to actually go, sort of start off in a compensation pattern. And what actually happens in Mark's case is it starts off kind of in this direction, but ultimately comes up in a compensation pattern up through the left side. He was, of course, the crossover pattern. And what you're actually seeing with the elevation on this side is the spine kind of adjusting in an effort to compensate for what this imbalance is in the hips or in the pelvis. It comes up this side, up into his neck region, and the brain is kind of a neat thing. It wants us to hold its head. It wants us to be up straight. So if in fact the individual has kind of an imbalance pattern in the lower part of the body or in the upper torso, it has no choice but to make that final adjustment in the neck. And what you get in Mark's case is this kind of an effect of him tilting his head in the C1 and C2 region of the neck in an effort to hold up straight. When I actually push on that, that triggers a reflex that actually corrects his leg balance. It's one of those kind of interesting things. So that's a very simple method for kind of assessing what somebody has going on with them in terms of an imbalance pattern. And it's a very simple process for correcting that. What we do is we take a wedge. It's going to look like a very large doorstop, for want of a better description. And we're going to place that at the top of the femur head on the short leg side. So in Mark's case, we'll ask him to raise up. We'll slip that right under the top of the right leg, so kind of just in this region. And on the opposite side, we're going to place it under the hip bone. The placement of this is usually or not usually, it should be at a 45-degree angle, pretty much the same as if you were putting your hands in your pants pockets. So again, in Mark's case, it's going to be on the hip on this side, top of the femur head, on the right side. If it was a reverse pattern, if he was short on the left side, it'd simply be the opposite positions with the wedges. And what that actually does is it enables the hip on that side that had rotated too far backward to relax and go forward, and the hip on this side that had gone too far forward is kind of forced or kind of blocked, if you will, into going backward. And when you do that, you come back down and check the leg balance. You'll see right now that the leg balance is even. We'll go back and repeat that first exercise where we raise the legs. And I'll just ask you to comment on whether you feel any different at this point in time. You may or may not, but sometimes you'll see...
Discomfort.
What's that?
There's no discomfort.
Okay, so, and oftentimes that's what an individual will report, is the fact that, you know, there's either greater range of motion or a little less tenderness. We'll come back up into the neck, and I'll push on that point before that kind of smarted a little bit, and you can just tell me whether that feels any better than it did before.
Yeah, it's not there.
Okay, so, and that's a common result from people, or that you get with people. What we're going to do now, as part of the actual pulsing process, we'll start by placing the probe, or the coil, if you will, down in the pelvic region. Always when you're doing this in a sort of with a person, especially if it's the first time, or if you're switching regions, turn it all the way, virtually to almost the lowest intensity possible, and then bring it up to learn what the person's comfort level is. And again, what we recommend in terms of usage with the machine is we tend to position it in such a way that the individual actually has access and control over the power button and can turn it up to the level that he or she find most comfortable. Mark, of course, is an old hat at this. He does it all the time. So he's turned it up to a level that may be, higher than most other folks. And again, it's an individual thing, so folks will learn at what level they will actually use that's right or best for them. What we would do typically with this as well is we probably use the machine or use the pulsing twice in the pelvic region like this. We would then, and that would be 2 repetitions by hitting the red button for 3-minute intervals. We then move it up into, kind of if you move it almost the distance of the coil upward, we probably go twice here, twice up in the shoulder, or kind of the upper back shoulder region. And there's a lot of other things you can certainly do with the person in this position. If they were reporting hip problems, for example, you can take the coil, use it almost like a pent, like a pent leg, slide it up over the person's leg so that it ends up in the position of kind of under the hip and across the back of the hip in this sort of a way. But again, with the leg down through it. You can similarly do the same thing for the shoulders. So there's a lot of different options you have in terms of how you would use the pulse at this point in time. But the great thing about using the wedge protocol is what you've actually done is you've corrected the imbalance pattern, the structural imbalance. So generally the person is going to get a better result just by virtue of having the body imbalance corrected.